Assalamu alaikum, Ramzan Mubarak. I hope you're having a very lovely Ramadan. My name's Anum Awais and I am an orthopedic doctor in SA Health. I will be talking about a clinically tailored overview of how Ramadan and fasting may affect joint and muscular health with practical guidance in outpatient settings and perioperative care. I'll start with inflammatory conditions including rheumatoid arthritis. Common misbelief is that joint pain increases during fasting time. Research has shown that it actually significantly reduces joint pain. It is important, however, to understand taking your medications and taking your dosages in the correct timeline, as well as making sure that you do not miss your medications, including DMARDs, NSAIDs, and any biologics that you take. At times, steroids may need to be readjusted during fasting time. And now I'm going to talk about degenerative spinal conditions or wear and tear of the spine. Symptoms often worsen during the end of the day. It is imperative to understand to have risk modifications in these types of situations, including ensuring no sedentary lifestyle during the day and adequate core strengthening. You can perform your exercises after iftar, and you can also modify your prayer posture if you are symptomatic with any spinal conditions. Next, I'm going to talk about post-operative musculoskeletal patients. It is important to understand that post-operatively, the first 6 weeks are imperative for bone and wound healing, and therefore Islam has given us the leeway of being able to skip those fasts in the first 6 weeks and continue those fasts later on in the year. However, if you are post the first 6 weeks of your surgery and your wound has healed and you've recovered, mashallah, well, you can continue your fast as normal. Key issues to understand is that rehabilitation in the first 6 weeks are imperative to have the best outcome for your surgical procedure, whether it is in an elective setting or trauma setting. Lastly, I will talk about athletes or people with physically demanding occupations. The key issue to understand here is that reduced power output and endurance is usually late in the day after your fasting, which can risk increased levels of muscular cramps. It is recommended to train before iftar or after iftar or before sahur, and prioritize carbohydrate and proteins in your diet. It is also important to understand that with fasting, your glucose production is via ketoacidosis rather than your normal glucose production pathways, and therefore the utilization of your muscle proteins are incredibly less. Your standard glucose metabolism is altered during Ramadan and fasting. You are using focus more on fat metabolism and usage of your energy. Towards the end of the day, your muscle bulk remains stable. However, you may feel some muscular cramps because you're utilizing other energy sources. And lastly, bone health is unaffected and it does not appear to be adversely affected during Ramadan. I hope you have a great and healthy Ramadan and wish you all the best.